are the common causes of ED?
Well, there are many factors that go into a functioning and working erection. The first factor that is typically we talk about is a vascular factor, that is bringing blood to the penis. This consists of the arteries, not only the large arteries like the aorta and the iliac arteries that are bringing blood from the heart, but often it's the smaller arteries, what we call the helicine arteries of the penis, that are bringing that blood into that organ that are damaged and can result in decreased blood flow through a variety of factors, which we can talk about. There's also a neurologic component. There is a complex interplay of our two different nervous systems. This is not the somatic nervous system like, hey, I'm moving my hand. This is the autonomic nervous system. This is the nervous system that passively controls how our body works without us thinking. And the passive nervous system that's involved in getting an erection is the parasympathetic nervous system. And what this basically does is these parasympathetic nerves, when it's time, an appropriate time to obtain an erection, they sort of shut off the efflux or the outflow of blood from the penis. So you have a relative inflow with a decreased outflow. Simple hydraulics, you got a woody. Some other factors that are involved in this are a lot more complex, higher cortical things that can affect how your erection functions. For instance, something that anxiety, anything that activates anxiety where you're nervous, a higher cortical function or sensation can create activation of the sympathetic nervous system. This is the opposite of the parasympathetic nervous system. This is that fight or flight reaction where blood is brought back to the core of the body, which means away from peripheral organs like the penis. This can also be affected by a lot of medications, and along all of this, all the spectrum, both vascular, neurologic, and psychogenic, can be an interplay of one's medications. And lastly, sort of related to all of it, is general health status, cardiovascular fitness. Can you walk up a flight of stairs? Are you healthy enough for the rigor of sexual activity? So all this is kind of interplaying, and it's often complex and multifactorial, and rarely is one the sole cause of decreased erectile function.
So it could be an overlap of a lot of issues.
Usually it is, and so you fix what you can and you address what you can, and your ultimate goal, as I mentioned, away from just looking objectively at the IEF like as a research tool, is satisfaction of the patient and their partner.
And usually it seems like all of the factors are interconnected. So if you kind of fix one, then it's a domino effect.
Yes,
correct?
often just fixing one can be all you need to tip you over to where there's that satisfied endpoint where you're like, you know what, this erection is working for me, it's working for my partner, I'm pleased. And sometimes it requires some substantial tweaking. Particularly, there are certain medications which we can talk about later that are pure erectile function killers.
So where do most men sit on the severity spectrum?
Well, what I will say is, regardless of where you are, there's a lot of pathways to improvement for men, whether you're young with mild ED, or middle-aged with severe ED, young with severe ED. There's a lot of ways we can mitigate those factors, make those lifestyle modifications, change those medications, and work on getting, again, a satisfactory erection that's satisfying for you and for your partner.
So is there a difference between guys who maybe can't get it up versus guys who simply can't maintain it?
Yes and no. A lot of the time for patients that have a physiologic problem like decreased inflow, diabetes, hardening of the arteries, hypertension, it's an obtaining problem, right? They can't physiologically obtain the erection. There's not enough blood flow going in or too much outflow going out. In my experience, the patients that have trouble maintaining it typically have some other factors. These can be medications, psychological issues, anxiety. And so these factors, again, it blends over. There's no one that has exactly one versus exactly the other. But in my experience, the obtaining an erection tends to still be very psychological, but it tends to be more related to physiologic issues, and the maintaining tends to be more related perhaps to psychological or psychiatric or medication factors.
Do you think that ED could be the symptom of a larger issue? Erectile dysfunction, it is a medical condition to a point, but so much about sex is psychological. We're dealing with so many variables when you're dealing with the sexual experience, from how society has constructed what we are supposed to do in the bedroom, to having a larger issue within the relationship, the lack of communication, the lack of trust in the bedroom, expectations you put on yourself. So once you build up how you're supposed to perform, or even what the relationship is supposed to be like as a couple, often erectile dysfunction can bleed into the bedroom as all subconscious and something that's actually something much deeper. And that's why when you work on erectile dysfunction, you really have to work on the whole relationship. Actually take the penis sometimes completely out of the equation.
I don't want to take the penis out of the equation.
No, it's fun. No, seriously. We forget
it's like a zero-sum equation.
You forget what it's like to be a teenager, right? Do you remember being a teenager when holding hands was really exciting?
Oh, absolutely.
And then you started the base work. Who remembers doing base work anymore, right? You
Talking on the phone, falling asleep at night.
Oh my gosh, yeah. Or even doing stuff over the pants, touching each other, going to the movies and just bumping into shoulders. Mm-hmm. It's taking it back to a level where you can remove the
penis.
The erogenous zones, but by the way, it reduces this need that you have to perform in a way. It actually makes stuff a lot easier, and then you build up to bringing the penis back in. And by the time you bring the penis back in,
it's hard to get back to that. It's hard to get back to that place though when you're especially if you've lived with somebody or
Sure,
or once you've shared a bathroom.
It's homework, but it's fun homework. And by the way, it's not even just physical. Intimate play goes way farther than that. And it's bringing play back into the relationship. It's building on so many levels.
When treating ED, how important is it to root out other serious medical concerns?
Oh, it's very important. Absolutely. For lots of reasons. One, because they might be serious medical concerns that need addressing for, very vital reasons. Mm-hmm. And then as well, we're not going to get very far with the psychological aspect if there is, an issue underlying that's really causing the ED. And that can be, anything from blood pressure issues to side effects of medications, to use or overuse of substances, non-prescribed substances. So all those things need to be assessed.
What's the ratio of actual medical, serious medical reasons for ED as opposed to purely psychological reasons?
I'm trying to.
Is there even a way to assess that?
I think that surprisingly few instances it's medical versus psychological. I think a lot of times people sort of assume there's something medical happening. That's why they go to their doctor originally, but a great proportion is more psychological in nature, and then some are kind of a combination. Mm-hmm.